Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are doing a high-yield ANCC PMHNP exam review for my PMHNP students. We are going to cover the first 15 practice questions. Remember, the goal is not just to memorize the answer. The goal is to understand why the answer is correct. So grab your notebook, grab your coffee or whatever keeps your brain from buffering, and let's get into it. Question 1. Let's start with the first scenario. A pregnant patient with MDD stopped her antidepressant. She refuses medication and asks about St. John's wort. What is the best response? A. Encourage it. B. Restart immediately. C. Provide counseling and psychotherapy. D. Discharge the patient. The correct answer is C. Provide counseling on risks and benefits, recommend psychotherapy, and discuss non-pharmacologic supports. The PMHNP should use shared decision-making and provide education about the risks of untreated depression during pregnancy. St. John's wort is not automatically safe just because it is natural. Natural does not always mean harmless. Example: pregnancy questions usually test risk-benefit counseling and shared decision-making. Do not automatically choose natural. Question 2, moving forward. A pregnant patient with mild depressive symptoms refuses medication. Which intervention is most appropriate? A. Cognitive behavioral therapy. B. Inpatient hospitalization. C. ECT. D. Start lithium without consent. The correct answer is A. Cognitive behavioral therapy. Psychotherapy is appropriate for mild to moderate depression. Example: if a pregnant patient refuses medication and is not acutely unsafe, therapy is usually the best next step. Question 3, let's dive in. A patient with schizophrenia wants to stop all antipsychotic medications. What is the PMHNP's best initial action? A. Give a long-acting injectable. B. Explore concerns and assess capacity. C. Stop medications. D. Deny right to refuse. The correct answer is B. Explore the patient's concerns, assess capacity, evaluate risk, and provide education about relapse. Example: do not jump straight to LAI. First assess capacity, safety, insight, and the reason for refusal. Question 4. The next question. A stable patient with capacity insists on discontinuing medication despite relapse risk. Which approach is best? A. Gradual taper and monitoring. B. Secretly continue. C. IM haloperidol. D. Refuse to see patient. The correct answer is A. Collaboratively discuss a gradual taper and close monitoring to respect autonomy and reduce harm. Example: if the patient has capacity and refuses treatment, think autonomy plus harm reduction. Educate, collaborate, and monitor. Question 5. Laboratory values. Which laboratory value is generally considered a normal adult serum calcium level? A. 2.5 to 4.5. B. 4.0 to 6.0. C. 8.5 to 10.5. D. 12.0 to 15.0 milligrams per deciliter. The correct answer is C. 8.5 to 10.5 milligrams per deciliter. Memorize this range for the exam. Question 6. Now for thyroid patterns. Which thyroid pattern is most consistent with hyperthyroidism? A. Low T3/T4, high TSH. B. High T3/T4, low TSH. C. Normal T3/T4, high calcium. D. Low calcium, high TSH. The correct answer is B. High T3, high T4, low TSH. Remember, hot and hyper. Question 7. Let's look at another thyroid case. Which thyroid pattern is most consistent with hypothyroidism? A. Low T3/T4, high TSH. B. High T3/T4, low TSH. C. High calcium, low TSH. D. Low sodium, normal T4. The correct answer is A. Low T3/T4 with elevated TSH. Hypothyroidism can often look like depression. Question 8. Now for neurodevelopmental conditions. Which condition is most commonly associated with both obsessive-compulsive symptoms and motor or vocal tics? A. Tourette disorder. B. MDD. C. Panic disorder. D. Delirium. The correct answer is A. Tourette disorder. It is highly comorbid with OCD and ADHD. Question 9. A pediatric symptom cluster. A child has repetitive intrusive thoughts, blinking, and throat clearing. Which comorbidity should be assessed? A. Tourette disorder. B. Dementia. C. Schizoid personality disorder. D. Narcolepsy. The correct answer is A. Tourette disorder. In children, tics plus OCD symptoms is a high-yield pairing. Question 10. Chronic pain and mood. Why are patients with chronic pain at increased risk for developing mood disorders? A. Overlapping neurobiological pathways. B. Protects against depression. C. Only if pain is imaginary. D. Causes schizophrenia. The correct answer is A. They share overlapping pathways involving serotonin, norepinephrine, and stress response systems. Question 11. Duloxetine pathways. A patient with chronic neuropathic pain and depression asks why duloxetine may be helpful. Best explanation? A. Affects serotonin and norepinephrine. B. Cures pain permanently. C. Works as a sedative. D. Is an antipsychotic. The correct answer is A. Duloxetine is an SNRI useful for both mood and pain modulation. Question 12. GCS classification. A patient has a traumatic brain injury with a Glasgow Coma Scale score of 11. Classification: A. Mild TBI. B. Moderate TBI. C. Severe TBI. D. No TBI. The correct answer is B. Moderate TBI. GCS 9 to 12 is moderate. 13 to 15 is mild. 3 to 8 is severe. Question 13. Fluoxetine trial. A patient on fluoxetine for 3 months reports little improvement. What should the PMHNP do next? A. Reassess and optimize. B. Wait 1 more year. C. Stop abruptly. D. Add 3 antidepressants. The correct answer is A. Lack of response after 6 to 8 weeks requires reassessment first. Question 14. Bupropion trial. A patient has been taking bupropion for 3 weeks with no improvement. What is the best response? A. Stop immediately. B. Explain it's early and reassess. C. Diagnose treatment-resistant depression. D. Add lithium. The correct answer is B. 3 weeks is often too early to determine full response. Give it a fair trial. Question 15. The final question. A pregnant patient is told her pregnancy is not viable. What is the most therapeutic response? A. Don't think about it. B. Move on quickly. C. Emotional and grief support. D. Impose specific rituals. The correct answer is C. Respond with compassion, validate grief, and support patient-centered choices. Quick recap. Remember your thyroid patterns, calcium ranges, and the importance of shared decision-making. Thank you for watching. For support, text 8329916 and subscribe for more educational videos. Join our mentorship family today at academy.rotationmatchnetwork.com. See you next time.